I had to challenge a good bit of the study done in London by the British Center for Crime, funded by that British Center for Crime. It says that alcohol is much more lethal to society and individuals than heroin, crack, or meth. That might be true for a good part of Britain, but I'm not sure that's really true here in the United States. Certainly, there's a huge societal expense as it relates to alcohol, and there are many, many more people that use alcohol than drugs like cocaine, heroin, and meth. But, you got to think about where are things going? What are the trends? I had the opportunity in '08 and '09, December of '08 and January of '09, to spend 2 months down at the Cleveland Clinic in their drug and alcohol treatment center. I had a chance to visit with many of the people that were in there for rehab and detox. The majority of the people were young heroin addicts in the 18 to 27, 28 age group. It was probably 4 or 5 to 1 heroin addicts to alcoholics. And so we're seeing a tremendous trend here in the United States. In London, London doesn't have the problem of Mexican cartels that have marketing programs to sell heroin, crack, and meth into our schools in almost all parts of the country. That's their game plan. That's their marketing plan. They're incredibly well funded. So we've got all these drugs, cocaine and heroin, coming up through our borders, where England doesn't have that same problem. Britain does not have that same problem as we do. They have a huge problem in drug addiction and alcohol, like every society does today. But when we look at what's going on here in the United States, we have to look at things a little differently. And we have to worry about what the cost is for our society as the cartels and addiction are capturing a whole generation of our youth. It is easier to get heroin in middle school, in the better schools, and any school, but mostly the better schools in this country, in the United States, than it is to get beer. So we've got people becoming heroin addicts much sooner than becoming alcoholics. And the drug is so much more powerful. So what's the real cost to society? What is the cost today in healthcare cost when we're seeing in treatment centers a significantly larger percentage of people in there for the detox of heroin? And I see that as a much bigger problem and a growing problem here in the United States than the London study. Absolutely, alcohol, you've got a much greater group of people that aren't alcoholics, that are heavy social users, heavy social drinkers. And they do get into car accidents, and they do have health care problems, and they do destroy families. But if you take a look at what's going on in rural as well as urban America, you look in the rural areas, even around here, we're in Cleveland, Ohio, and Ohio is kind of a microcosm of the entire country. And you look at what goes on as you get into more rural environments, you've got huge epidemics of meth and heroin going on. And these are, in many times, poor parts of society. Then as you move closer to the urban, and into the cities of, for instance, Cleveland, Akron, Columbus, then you're seeing this heroin use amongst our youth. So what are we supposed to believe? Where are we supposed to put our money? Where is education going to get involved? I think when you look at education, certainly prevention is important. But the fact is that so many people become alcoholics. They become meth heads. They become crackheads. They become heroin addicts. What do we do with that population? How do we get them into recovery, into real recovery? And there, I think education is involved. But I also think the 12-step recovery is an easy solution. It was invented in the 40s. There's no need to make it any better. There's a treatment program that works, and it works if you work it. How do we get 12-step recovery into treatment centers, into jails and prisons, into schools, into youth centers, into juvies? How do we do those things? That's what we have to think about. How do we connect our youth? How do we connect the people that are suffering from the disease of alcoholism and addiction to the recovering community? That's what the key is. That's what we have to be able to do. We have to bring real recovery to where it's needed the most. Alcoholics, yes, but when we look at our youth, it is a very small minority that are pure alcoholics. And what I mean by that, it's somewhere in the 10 to 15% of those that are getting into treatment centers, that are going to jails and prisons, are alcoholics. The rest are addicts, and a vast majority of them are heroin addicts. We don't see crackheads and meth heads in treatment, mainly because there is no detox for cocaine. So, guess what? Healthcare companies, the health insurance companies no longer cover for detox of heroin. So, what do we do with those? There's no place for them to go. That's a big problem. Those aren't in those statistics. We don't see the destruction within the ghettos, within the schools. It's very hard to measure, and and it's a problem that if we take the resources we have right now and apply it to bringing recovery to where it counts and where it's needed, we have a chance of making a dent in this battle, and hopefully soon start to win it.